Hello, my name is Dr. Catherine DeUgarte. I'm a reproductive endocrinologist and infertility specialist at Pacific Fertility Center, and I have been working with this lab for about 20 years. In terms of options for women, men, and couples, there are many options available by IVF. You can have a baby if you're single. You can have a baby if you're two women in a relationship, two men, or a woman and a man. Obviously, depending on the situation, sometimes you might need either an egg donor, a sperm donor, a gestational surrogate, or a combination of all of those. For two women having a baby, they usually require a sperm donor. So when I meet with my patients, we go through their history. We talk about the options of either doing an insemination, where we put the sperm directly into the uterus, or we do the in vitro fertilization after they select their sperm donor, and we put the eggs and the sperm together and then put the embryo into one or both of their uterus, not at the same time. Sometimes in my same-sex couples, sometimes both of them want to be carriers for their baby, sometimes just one. Sometimes one wants to use their eggs and put her embryos into the other person's uterus, and sometimes just one person would like to give the eggs and carry the baby. So I talk to them about what they prefer. In terms of patients who are two men, so they need to get an egg donor and a surrogate. They can either get an egg donor from somebody they know in their family, or an anonymous donor through an egg agency. We are lucky at PFCLA to have our own agency called Hatch Agency, which has some amazing egg donors. And we help the patients find the perfect egg donor for them. In terms of the process of finding an egg donor, I recommend finding a donor, if possible, that's been ideally a donor beforehand, so that we know she has success with her eggs. We pick that donor based on her history, family history. We make sure that she doesn't smoke marijuana or do cigarettes or excessively drink, and that she's available and responsible. We do psychological testing. We do testing on her blood tests. We check her for STDs. We check her for thyroid diseases and other hormonal abnormalities. We check to see how fertile she is. We check some blood tests called the AMH, E2 FSH levels. If she has an IUD, we can't check the E2 FSH levels, but we can still check the AMH level and check to see how many follicles she has by ultrasound, and see if she's a good donor for this couple. The more eggs that a donor has, the better the chances of this couple having multiple children from that one donation process. In terms of the process for the egg donor, once we pick the egg donor and she has a normal psychological profile and normal genetic testing, we also make sure that if she carries a genetic mutation, that the couple, let's say it's two males, that they're not positive for the same mutation that the donor's positive for. Then we bring her in for a medical evaluation and we do a medical screening, and then if she passes that, then we do a legal contract between the intended parents and the egg donor. And then she comes in to do a cycle where she takes fertility medications for about 10 days. During that time, she does several ultrasounds, blood tests, and then we do an egg retrieval process. We check her for STDs, something called an FDA panel, within 30 days of the egg retrieval. And then we remove the eggs by putting her to sleep. We remove the eggs directly from the ovaries, which are enlarged at that point and easier to access vaginally with a needle. We take those eggs, we put them in a dish. We put the sperm into her eggs. If it's two men and they each want to be a genetic father, we use half of her eggs for one sperm and then half of her eggs for the other partner's sperm. And then once they create the embryos, they can decide who goes first, which embryo comes home first. Once we get the embryos fertilized, then we take them out to day 5. And if we start out with 20 eggs, you might only have 16 that fertilize. You might only have 10 that make it to day 3. You might only have 6 that make it to day 5, and you might only have 4 or 5 normal embryos. Once you have the normal embryos, then that couple is then looking for a gestational surrogate. For a surrogate, we're very picky in terms of finding somebody who has few C-sections in the past, and mostly vaginal deliveries, who is responsible, is in a stable relationship, and has no drug history, especially currently, no alcohol use, and lives a healthy lifestyle and has a normal or just above normal BMI or body mass index. Once we find a surrogate, we have them screened. We do blood tests on her, make sure there's no STDs, make sure that her hormones, especially thyroid hormones, good. Make sure she doesn't have a high blood pressure, normal weight, and we check her uterus to make sure that her uterus doesn't have any fibroids or polyps. We do something called a fluid ultrasound to make sure that it's all perfect for the embryos that are going to come into her uterus. For the surrogate, we also do a legal contract once she's been fully medically screened. And then we do something called a transfer procedure where we give her estrogen pills and progesterone shots usually. And then 3 weeks later, we do an embryo transfer where we take an embryo and put it directly into the uterus 6 days after the progesterone starts. 10 days later, we hope that she's pregnant. And 9 months later, hopefully she delivers a healthy baby. In terms of how long does it take to find an egg donor and a surrogate, the egg donor can take up to 3 to 6 months, depending on how picky the couple is. And then again, it takes a month to screen her, a month to do the legal, and a month to do the process. The surrogate can sometimes take up to a year, and you need to have normal embryos frozen before you're able to match you with a surrogate. And that takes sometimes up to a year. The actual screening of the surrogate only takes a few months, 1 month to screen her, 1 month to get the results, 1 month to do the legal, and 1 month to do the actual cycle where she takes the estrogen and progesterone. In terms of pregnancy rates, if you have a surrogate and an egg donor, and you have a young egg donor, success rates are about 70 to 80% chance per embryo transfer. So very high chance of success if you're using an egg donor. For single women, in terms of options, you can either freeze your eggs for the future, you can freeze embryos with a sperm donor, or you can choose to do an insemination with a sperm donor where we put the sperm directly into the uterus, or we can do in vitro fertilization where we can take embryos and put them into the uterus after doing genetic testing. Thank you for your time. If you have any questions about third-party reproduction, finding a donor or a surrogate, or any other questions, please call me at Pacific Fertility Center.